Hello people, it's been a wee while since I did a video. I've got some news. It's not greatish news. I'm going to try and hold it together. I got given it a couple of weeks ago. Not even a couple of weeks ago, only a week and a bit ago. As you know, we've done everything we could to work up towards the lung transplant referral. I managed to see the consultant, Nik Hirani, who was an interstitial lung disease specialist. There's not many of them out there, and that's the type of disease that I have. It's very, very rare. To put you in the picture of how rare it is, the consultant that I originally had only ever, I think in his 25 years experience, only really saw me and another patient with that type of disease. So there you go. I mean, and when I spoke to this man, I thought, oh, please be my consultant. And he said, well, I'll be your specialist consultant, but I can't be your primary consultant because the lung transplant team will want to deal with Forth Valley, which is my area. So anyway, I've been waiting since November to hear and maybe do the tests that I was told, probably get some blood tests, get some walking tests and things like that in preparation for all the things that you have to go through for the lung transplant referral process, so before you even get on the list. And what happens? Now, I don't know if, for those of you that follow me, this is 5 years now I've had this. And I mean, they wrote me off in 2019, gave me a year to live. I think they just expect me to die. Like, it was Christmas 2022 when I was ill, remember, for 3 months. I had all the infections and I was sent home for Christmas and said I should have been in the hospital getting intravenous antibiotics, and they sent me home saying if you get really, you get worse, you have to go to hospital. I was like, that's fine. Well, I stayed at home and I completely recovered and I lived again. It's like the third time cheating death. And in this winter I've stayed completely healthy. So I'm getting the hang of this, keeping these wee lungs that I've got. So all I want is a chance of getting new lungs. I've worked my ass off to get down to the BMI with being on the steroids. I no longer have a heart complaint. A paid member with thank you so much for everybody that donated to the GoFundMe, because NHS let me down in October with my DEXA scan appointment, so we got all the scans done. I saw specialists that I paid for, so they had all the evidence that we needed. But unfortunately, they wouldn't accept my DEXA scan in the NHS because it was done on some other machine. Now, I don't know if the numbers and the scores of your bone density is the same or whatever, but they won't accept it. So therefore, I don't know what's been passed on to the lung transplant referral team, because this is the letter I got. I'm just going to read it to you. I'm like, there's no confidentiality, you know me. I'm an open book. So this letter was from the consultant, Nik Hirani. Now, 1, I've not had any correspondence whatsoever from the lung transplant team. 2, I've been in contact quite a lot with my respiratory nurses at Forth Valley, trying to build up a relationship. So I have a nurse there, and I wanted her to support me on the agreed titrations that we were going to do, so the agreed medications that we were now going to come down off of. I sort of didn't move on my medications before I saw a specialist, because I thought, if I move on it, what if I go downhill and they're not going to see me at my best time, and I'm wanting to get this lung transplant. So that's why I didn't really move last year on my medication, like my steroids and other things. Apart from painkillers, I managed to get down off of them. So now it's two of the main things, like morphine, which I don't take for pain. I take that for breathlessness. Well, that's why it was prescribed. And it was prescribed, and then it got added on more and more and more throughout the years. But remember, if you follow me, The first 2.5 years I was living with broken bones, undiagnosed broken bones. And if you follow me, you'll also know the story behind that is that I was basically failed by the NHS, because if you are on steroids, prednisolone, you must get a DEXA scan and be on bone protection medication within 2 months. It took them 2.5 years. And only because I insisted on it. And that was after seeing scar tissue in a CT early on in 2019, I think it was. Seeing scar tissue from broken ribs and sternum, so it's my sternum, that bone here, and my third rib, had actually had a consultation with the consultant, because I asked, whereabout is these bones I'm supposed to have broke, because I have no injury and never done anything. So all this time my bones were breaking just through living a normal life. I mean, I wasn't out like side, you know I love my garden, I wasn't outside digging and things like that. I was just living a normal life. In fact, I hardly had any energy. I couldn't do anything, so I wasn't doing anything strenuous whatsoever. So my breathing was terrible. There's no way I could even have speak. I've gone blah 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 like this now. There's no way I could even have spoken like that at that time. So that's why they increased my morphine, you see. So I was a different person back then. So that's why I asked the medical team, I really want to see if I can now move on the morphine that I'm on, because I feel I'm a different person. I feel I don't need it for breathlessness. Let's see how low we can go. So I've been titrating on that, and also on the prednisolone, the steroids as well, again. So pretty nasty side effects. So this is what I've been doing since November. In fact, I'm telling fibbies, I'd not been doing it since November because I wanted to enjoy my Christmas. I've been doing it since Boxing Day. I care about New Year. So I've been doing it since Boxing Day. Boxing Day I moved down on the morphine first. Anyway, there's another story, but I'll tell you about that another time, why I decided to move on morphine first. But I moved on the morphine first. Oh my goodness. Trainspotting. Have you seen the movie? Here's renting. I'm renting. Like one of my Buddhist pals joked the other day, saying if you want us to lock you in a room, slide in a tray chicken soup. Just let us know. Oh, it's honestly, it's no nice, the side effects. But you know what? I've done it before. It's not my first rodeo. Doesn't last forever. The other night, I was petrified. I was having night sweats, hallucinations. It's like, Daddy, Daddy. I thought he was like standing on the top of me, like trying to scare me and that. And he wasn't. He was still sleeping. And he was like, "You alright?" And he was just like held my hand. And because he held my hand, I got myself back to sleep very, very quickly. It was like he was soothing me, and I got back to sleep, and that was fine. But oh, that was pretty scary. That seems to only happen once. Anyway, I'm diverging. I'll do a whole other thing about this because it might help somebody with all the side effects that you get and how to manage them. Right, back to this letter. So the letter, like I say, it come from Nik Hirani, the specialist consultant, and like I say, I've had no contact from the lung transplant team whatsoever. I've now got Strathcarron Hospice, the medical team, back to see me, the lovely Maria, who is my favourite. She's amazing. They are so lucky to have her. Oh, I don't know what I would do without Strathcarron, honestly. I really don't. Like, I donate all the time. If you can donate anything, give to that charity. Honestly, they are just amazing. Amazing, because they are getting all welled up when people are nice to me. Anyway, I've got Maria back on the case. I'm building up a really good relationship with my respiratory nurse, but I feel she's a bit scared to make big decisions with anybody. But that's the story of my life with this disease. Nobody wants to make a decision, and that's how having a consultant, I feel like I've been missed. and like they've just sent me to palliative care. But like Maria agrees with me, she's like, you still need your disease treated. I says, I know, I need a consultant. So anyway, I got this guy's great. Well, his secretaries are great. I've just been off the phone to his secretary today and praising them how amazing their communication is. I was like, oh, Nick's really good at his communication. In fact, you know what, it's no Nick, it's you. It's you. Like, you put the letters out, you're amazing, thank you so much. Anyway, I got this on the 24th, so just over a week and a bit ago. And it says, I'm writing because I have received a note from Dr. Lorden from the Freeman Transplant Unit. So that's the transplant unit down in in Newcastle, explaining that the lung transplantation has been declined because of osteoporosis and the associated risks of further bone thinning with transplantation. Now, out of everything, to have it done for bones, it's sad. I feel it's out with my control. I know, right, realistically, I'm not saying, like, I know that my bones may have deteriorated because the years have been on prednisolone, but they certainly wouldn't be in the state they are now, or I wouldn't have been living with broken bones if anybody had picked up on something and I had been treated as a patient like nice guidelines say, that's the government guidelines, and been given a DEXA scan and put on bone protection medication at the beginning, 2 months from having been on prednisolone. I was on 50 milligrams at one point for a very, very long time without any bone protection medication, and that was when I, ended up getting type 2 diabetes because of drug-induced diabetes because of it and things like that, which, it's really, that is like non-existent now basically. I've not been taking medication for that for 2 years. So, I mean, I have worked my butt off, like, reducing everything. So this is like a kick in the teeth. And you think, what is it that... Is it because they think they're going to break the bones? No. I'm unsure. So this is my understanding after looking and researching and looking at guidelines. My understanding is it says and the associated risks of further bone thinning with transplantation. So that's because after transplant they put you on bone thinning medication like prednisolone, which I'm already on, and I'm already on this like injection for to help build my bones and prevent further breakages. So therefore, I feel over a year now I've been living with no broken bones. The bones are starting to build a little bit better. That's why it's really crucial that we get this DEXA scan. So I've been on to the NHS team. The girls there are really good. They're just very, very busy. But they promised me a scan in October, then they promised me another scan, and then they made an urgent appointment. Then X-ray phoned me and said, oh, we had an appointment for you on the 1st. I think they phoned me on the 4th or the 5th of November and said, I'm sorry, we never got a letter out to you or whatever. I was like, oh, it's okay, I've had it private. And then I got told, oh, we didn't accept it. I was like, well, put me in for another DEXA scan yet. So still waiting. So I've been chasing that up. So I don't know what they've made this decision on because of my bones. It's never too late to, like, obviously do another referral in more time, like a year or whatever. But I'm going to appeal this on obviously the grounds that everything else is great. I'm waiting now to hear back guidance and get an appointment with hopefully Nik Hirani. I can get an appointment with him. But I've also been given an appointment at Forth Valley to see a consultant. So on the 20th, they're now taking me seriously, and they had a multidisciplinary meeting because Strathcarron got involved. So they had a multidisciplinary meeting. I was sent out an appointment, so I'm going to see them on the 20th of February. My husband and son, so Dylan's getting involved as well now. He's like, Mum, I don't trust him. I want to know what's happening with you. So he's getting involved. Danny's power of attorney now as well, so he's got my back. I'm just trying to build up a good solid team. But I always said, if you are if they do end up refusing me because of my bones, I mean, the guilt is there. I had a phone conversation back, I can't remember, it was after, with my consultant, so that would have been September 22 was the last time I saw him. He was like, oh yeah, we'll do a referral for lung transplant, you just need to lose the weight and blah blah blah. And I was like, yeah, and I took the whole A23 to do all that. And then but before that, then after I was ill, he was like, nope, not even going to consider you. So anyway, that phone conversation never ever got put into my notes. That was a major like thing that should have been written up and put in my notes, because that was a formal like appointment. He was present, and so was one of the respiratory nurses, who said hee-haw in it. Actually, I was very disappointed in her. But I said, if it comes down to in my bones, I was given an apology, I was given a verbal apology, because I raised that about my bones then. And he was telling me all the reasons he wasn't going to put me through for a lung transplant, trying to tell me I had like heart failure and that. I was like, I haven't got heart failure, I've got like a thingy valve that's struggling. And then anyway, that got blown out the water, didn't it? I hate being right all the time. But you know what? They just look at my notes. I look really rubbish on my notes, because one, they're not up to date. I mean, look at me, look how well I'm talking. I could get up and do a wee dance as well. I've just finished pulmonary rehab. Like, I'm doing so well. I've still only got 23% in my lungs. But what I want to say is, I am going to ask for an investigation now. I wasn't going to do it, one, because, like, I don't even know if I want to do it. It's not even for, like, compensation or whatever. Give me a lung transplant, that's what I want. I didn't want, like, money or whatever. We're not sitting here flush. We've used all our savings, but we're happy. You know, I live a happy life. I just want to live longer. I want the opportunity to live longer. If somebody was to give me a lung transplant today, I would say no, I didn't need it today, because I'm doing pretty well. I mean, they don't give you it till you're struggling anyway. I mean, I think they only do about 20 a year, so the chances of getting one is very slim anyway. The odds are against me anyway. But I feel my mammy died when I was 4.5. She was 22. Her name was Patricia Connor, was her married name. And she went to the dentist to get her teeth out. It was an anaesthetist who was retired. It was an older machine. They gave her the wrong dosage and she died. Now, because she died, and other people died as well, it was like 1982, the laws changed. So her death led to the laws changing to protect people, so that when they went to get teeth out, they had to be done in the hospital if they wanted to get put to sleep. Now, I feel now my karma, I was sort of enlightened to it when I got this letter, that my karma is to change, whatever it is I have to change. I don't know whether it's this law of the bone thinning or whatever it is, but it's not through my death, it's through living, because I said I'm living till 100 and my pal says that's a bit ambitious. I says, well, I'd have wanted it to be 100 before I got this disease, so why should it be any different? Anyway, this is my plan, and that's all I'm saying. Have a good day, y'all. Bye.